Welcome back to the deep dive. Today, we're going deep on something, that you're probably already familiar with,
Okay.
melanoma.
Yeah.
We're gonna assume you know the basics, like it's serious and it's skin cancer,
Right.
and jump right into the fascinating stuff. We've
Yeah.
got research articles and clinical studies,
Uh-huh.
even some historical perspectives, all pointing to a future where melanoma might not be the threat it is today.
Yeah. That's precisely what's so captivating about this field right now.
Right.
It's not just about doom and gloom.
Yeah.
It's about real progress and hope.
Okay, so let's unpack some of this cutting-edge stuff.
Okay.
One of the sources mentions that people who use tanning beds increase their risk of melanoma by a whopping 75%.
Yeah.
That's a scary statistic.
It is.
Is that true?
It is, unfortunately.
Wow.
We know UV radiation is a primary driver of melanoma, and tanning beds are essentially
Right.
concentrated doses of UVA and UVB rays. It's like
Yeah.
fast-tracking your risk.
So tanning beds are out of the question.
Yeah. Yeah. What about those of us who love the sun but want to stay safe?
Well, sun protection is absolutely key.
Okay.
Think broad spectrum, sunscreen, protective clothing, seeking shade during peak hours.
Okay.
But here's where it gets interesting.
Okay.
One of the sources dives into the genetics of melanoma, highlighting that some people are genetically predisposed to it.
So even with perfect sun protection, some people are still at higher risk.
Unfortunately, yes.
Oh.
It's a complex interplay of genes and environment.
Right.
Family history is a significant risk factor, as is having a high number of moles,
Okay.
or atypical moles.
That makes sense.
Yeah.
So knowing your family history and keeping an eye on those moles is crucial.
Yes.
Speaking of keeping an eye out, how can we actually spot melanoma early?
That brings us to the ABCDE Rule,
Oh, yeah.
a fantastic tool for self-checks.
Could you break that down for us?
Absolutely.
And maybe give us some examples of what to look for in each category.
Let's start with asymmetry.
Okay?
Imagine drawing a line down the middle of a mole. Okay.
If the two halves don't match, that's a red flag.
So if one side is round and the other jagged, that's asymmetrical.
Exactly.
Huh.
Then we move to B border.
Uh.
A melanoma often has an irregular, notched, or blurry border,
Okay.
unlike a typical mole, which has a smooth, well-defined edge.
Okay, so a fuzzy or scalloped edge is suspicious.
Yes.
What about C?
C stands for color.
Okay.
A melanoma might have different shades of brown, black, tan, or even red, blue, or white, all within the same mole.
Wow.
A regular mole tends to have a consistent color.
So a mole that looks like a watercolor painting is a warning sign.
Precisely.
Okay, got it.
Next is D diameter.
Okay.
Anything larger than 6 millimeters,
Yeah.
about the size of a pencil eraser,
Right.
warrants attention.
Got it. Big moles are bad news.
Yes.
And finally, E.
E stands for evolving.
Right.
This is perhaps the most important factor.
Okay.
Any change in a mole's size, shape, color, or elevation, or any new symptoms like itching, blatting, or crusting, should be checked by a dermatologist.
That makes a lot of sense.
Yeah.
Any change, no matter how small, is worth getting checked out.
Absolutely.
Now, if a dermatologist suspects melanoma, what happens next?
Right.
How do they actually diagnose it?
A biopsy is the gold standard for diagnosis.
Okay.
It involves removing all or part of the suspicious mole and examining it under a microscope
Got it.
to confirm the presence of melanoma cells.
So a biopsy is the definitive test.
Yes.
But what about those other techniques we read about?
Yeah.
Dermoscopy and imaging tests.
Right.
When are those used?
Dermoscopy, which uses a special magnifying lens to visualize the skin's deeper layers,
Okay.
can help distinguish between benign and suspicious moles.
I see.
Imaging tests like MRI or CT scans
Yeah.
are typically reserved for cases where the melanoma is suspected to have spread beyond the skin.
So those additional techniques provide more information depending on the suspected stage of the melanoma.
Exactly.
You mentioned staging. Could you elaborate on how melanoma is classified?
Melanoma staging is based on how deep the tumor has grown
Okay.
and whether it has spread to nearby lymph nodes or distant organs.
Right.
Stage 0 is the earliest stage,
Okay.
where melanoma cells are confined to the outermost layer of skin.
So that sounds like it's highly treatable at that stage.
Absolutely. The earlier melanoma is caught, the better the prognosis.
Right.
As melanoma progresses through stages I and II,
Yeah.
it involves deeper layers of skin and may become ulcerated.
And what happens in the later stages, 3rd and 4th?
Stage 3 means the melanoma has spread to nearby lymph nodes,
Okay.
while stage 4, the most advanced stage,
Yeah.
Indicates it is spread to distant organs like the lungs, liver, or brain.
That sounds quite serious.
Yes.
This understanding of stages helps us appreciate how treatment options are chosen.
Yes.
Speaking of treatment, let's dive into that next.
Okay.
What are the main approaches doctors use to treat melanoma, especially in those more advanced stages?
Treatment for melanoma has evolved dramatically in recent years, while surgery remains a cornerstone.
Yeah.
Particularly in the earlier stages.
Right.
We've seen remarkable advancements in immunotherapy and targeted therapy.
Now, those sound pretty high-tech.
They are.
Tell us more.
Immunotherapy essentially empowers your own immune system
Okay.
to recognize and attack melanoma cells.
I see.
One type uses drugs called checkpoint inhibitors,
Okay.
which release the brakes on the immune system.
So it's like giving your immune system a boost to fight the melanoma head-on?
Precisely.
Okay, that makes sense.
And then there's targeted therapy,
Yeah.
which is incredibly fascinating.
Okay.
It zeroes in on specific genetic mutations found in some melanoma cells,
Wow.
disrupting the signals that drive their growth.
That's incredible. It's like a guided missile that only attacks the cancer cells.
Exactly.
It sounds like these newer therapies are really changing the landscape of melanoma treatment.
Absolutely.
Yeah.
They're offering new hope for patients,
Wow.
even those with advanced disease.
That's amazing.
But it's important to note that traditional treatments like radiation and chemotherapy still have their place in melanoma management,
Okay.
though they are used less frequently now with the advent of immunotherapy and targeted therapies.
It's really inspiring to see how far melanoma treatment has come.
It is.
But of course, prevention is always better than cure.
Absolutely.
What are some of the key things people can do to reduce their risk of developing melanoma in the first place?
Sun protection can't be emphasized enough.
Yeah.
It's not just about slathering on sunscreen,
Right.
though that's essential.
Yeah.
It's about a holistic approach.
Okay, so beyond sunscreen, what else does this holistic approach involve?
Yeah.
What are some of the less obvious strategies?
One source delved into the concept of sun protective clothing.
Okay.
These garments are specifically designed to block UV radiation
I see.
and are rated with a UPF factor,
Okay.
similar to SPF for sunscreen.
Uh-huh.
They can offer an additional layer of protection, especially for those who spend extended periods outdoors.
That's interesting. So long sleeves, pants, and hats.
Exactly.
But with this added layer of protection built in,
Yes.
what about those of us who love our outdoor time hikers, runners, beachgoers?
Right.
Any tips for staying safe while enjoying the sun?
One of the studies we reviewed highlighted the importance of timing.
Okay.
Scheduling outdoor activities for early morning or late afternoon,
Okay.
when the sun's rays are less intense,
Right.
can significantly reduce exposure,
I see.
and seeking shade during peak hours,
Yeah.
usually between 10 a.m. and 4 p.m.,
Right.
is a simple but effective strategy.
So it's about being strategic with your time outdoors.
Exactly.
Don't skip the hike, just adjust the clock.
Right.
What about tanning beds?
Yeah.
We briefly touched on them earlier.
Yes.
Are there any situations where their use might be considered safe?
The short answer is no.
Okay.
Every expert we consulted
Yeah.
and every research article we reviewed
Okay.
vehemently discourages the use of tanning beds.
Yeah.
The risks simply outweigh any perceived benefits.
So there's really no such thing as a safe tan from a tanning bed.
Exactly.
Okay.
Any tan, whether from the sun or a tanning bed,
Right.
is a sign of skin damage.
Got it.
It's the skin's way of trying to protect itself from further UV damage.
That's a powerful reminder.
Yeah.
It's not about achieving a certain aesthetic.
Right.
It's about protecting our health.
Exactly.
Now, shifting back to early detection for a moment.
Okay.
We've talked about the ABCDE rule and the importance of checking less obvious areas.
Right.
But what are some of the other subtle signs of melanoma that people might miss?
One source detailed a fascinating case study
Okay.
where the first sign of melanoma was a persistent sore that didn't heal.
Mm.
It wasn't a mole. It was just a small wound that refused to close up.
That's a good reminder that melanoma can masquerade in various forms.
Yeah.
It's not always about a distinct mole.
Exactly.
What other unusual presentations should we be aware of?
Another study highlighted changes in skin texture, a new area of thickening or roughness, especially if it feels different from the surrounding skin,
Right.
should raise a red flag.
Okay.
It could be a sign of something as benign as a wart
Yeah.
or as serious as melanoma.
So any change in the feel of your skin, not just the look,
Yes,
is worth getting checked out.
absolutely.
It seems like melanoma can be quite sneaky.
It can.
Yeah.
That's why awareness is so crucial.
Right.
Pay attention to your skin.
Yeah.
Know your body. And if something seems off,
Yeah.
Don't hesitate to seek professional advice.
Good advice.
Early detection is truly our best weapon against this disease.
Excellent advice. It's always better to err on the side of caution.
Yes.
Now, before we move on, I want to touch on something we've discussed before.
Yeah.
The fact that melanoma can be more difficult to detect in people with darker skin tones.
Right.
What can we do to address this disparity?
Raising awareness among both healthcare providers and patients is crucial. We need to ensure dermatologists are trained to thoroughly examine all areas of the skin in patients with darker skin tones.
Yeah.
And that patients themselves are aware of the potential signs of melanoma in less obvious locations.
So it's about education and vigilance on both sides.
Exactly.
Yeah.
And it's about increasing access to dermatological care for underserved communities.
Right.
We need to break down those barriers to ensure everyone has an equal opportunity for early detection and treatment.
That's a powerful message.
It is.
Everyone deserves a fair chance of fighting this disease.
Absolutely.
This has been incredibly insightful.
Good.
We've covered a lot of ground, from risk factors and early detection to the latest advancements in treatment.
Yeah.
And we've emphasized the critical importance of sun protection and regular skin checks for everyone.
Absolutely.
But there's still so much more to explore.
There is.
What else can we look forward to in part 2 of this deep dive?
In part 2, we'll delve into some even more surprising facts about melanoma, like how it can appear in unexpected places. We'll also explore the latest research on personalized medicine and its potential to revolutionize how we treat this complex disease.
Welcome back to our deep dive into the world of melanoma.
We've covered a lot of ground already, but as you mentioned, there's still some surprising twists and turns when it comes to this disease.
Right.
You hinted that melanoma isn't always a dark, pigmented spot.
Yes.
That really caught my attention. Can you elaborate on that?
Absolutely. One of the sources highlights a melanotic melanoma.
Okay.
A type that can be pink, red, or even flesh-colored. It's a bit of a chameleon and can easily be mistaken for something harmless.
Wow, that's a game changer.
It is.
So we can't just rely on the dark spot image we often have in our minds.
Right.
Does this mean the ABCDE rule is less reliable in these cases?
The ABCDE rule is still incredibly valuable.
Okay.
Even for melanotic melanoma.
It's just a reminder that any new or changing spot, regardless of color, should be taken seriously.
Right.
The other features, asymmetry, border irregularity, diameter, and evolution, can still provide crucial clues.
That's reassuring. So it reinforces the message that we need to be vigilant about any skin changes.
Yes.
Not just the ones that fit the stereotypical image of melanoma.
Right.
What else surprised you about melanoma while researching for this deep dive?
One thing that struck me was just how diverse the locations for melanoma can be.
Okay.
It's not just about sun-exposed areas.
Right.
One article detailed cases of melanoma arising in unexpected places, like under the nails, or the palms of the hands, and even inside the mouth.
That's unsettling.
It is.
You wouldn't think to check those areas for skin cancer.
Right.
What causes melanoma to develop in these less common places?
It's not always fully understood.
Okay.
But some of these occurrences, especially on the palms, soles, and nail beds, are linked to a cractal lentiginous melanoma, a type that's more common in people with darker skin tones.
So while we all need to be checking our entire body, these findings emphasize the need for everyone, regardless of skin tone.
Right.
To be aware of these less obvious signs, it seems melanoma doesn't discriminate when it comes to location.
Exactly, and that brings up another point that deserves more attention.
Okay.
Melanoma can be more difficult to detect in people with darker skin.
Why is that? Is it related to the locations we just discussed?
It is, as we mentioned, melanoma in people with darker skin.
Yeah.
Often appears in areas that aren't exposed to the sun as frequently.
Okay.
These areas might not be checked as routinely during self-exams.
Right.
Or even by healthcare providers.
So it's a combination of location and perhaps a lack of awareness.
Yeah.
About how melanoma can present in those with darker skin.
Precisely.
Yeah.
It highlights the need for more education and vigilance.
Right.
Dermatologists need to be particularly thorough when examining patients with darker skin. And patients themselves need to be aware that melanoma can appear differently on their skin.
That's incredibly important information.
It is.
It's clear that we need to be advocates for ourselves and our loved ones.
Absolutely.
Ensuring thorough skin checks that encompass all areas of the body.
Yes.
Now, we've talked a lot about the challenges of melanoma,
We have.
but let's shift gears and focus on something more positive. Prevention.
Okay.
What can people do to proactively reduce their risk?
Prevention is truly the cornerstone of melanoma control.
Right.
And when we talk about prevention, sun protection naturally takes center stage.
Okay.
But it's not just about sunscreen,
Right.
though that's a crucial component.
Yeah.
It's about a multifaceted approach.
Okay, so beyond sunscreen, what else does this multifaceted approach involve?
Right.
What are some of the less obvious strategies?
One source delved into the concept of sun protective clothing.
Okay.
These garments are specifically designed to block UV radiation
Okay.
and are rated with a UPF factor, similar to SPF for sunscreen.
Interesting.
They can offer an additional layer of protection,
Okay.
especially for those who spend extended periods outdoors.
That's interesting. So long sleeves, pants, and hats.
Exactly.
But with this added layer of protection built in,
Yes.
what about those of us who love our outdoor time?
Yeah.
Hikers, runners, beachgoers.
Right.
Any tips for staying safe while enjoying the sun?
One of the studies we reviewed highlighted the importance of timing.
Okay.
Scheduling outdoor activities for early morning or late afternoon
Yeah.
when the sun's rays are less intense
Right.
can significantly reduce exposure.
Okay.
And seeking shade during peak hours, usually between 10 a.m. and 4 p.m.,
Right.
is a simple but effective strategy.
So it's about being strategic with your time outdoors.
Exactly.
Don't skip the hike. Just adjust the clock.
Right.
What about tanning beds? We briefly touched on them earlier.
Yes.
Are there any situations where their use might be considered safe?
The short answer is no.
Okay.
Every expert we consulted and every research article we reviewed
Yeah.
vehemently discourages the use of tanning beds.
Mm.
The risks simply outweigh any perceived benefits.
So there's really no such thing as a safe tan from a tanning bed.
Exactly.
Okay.
Any tan, whether from the sun or a tanning bed,
Right.
is a sign of skin damage.
Got it.
It's the skin's way of trying to protect itself from further UV damage.
That's a powerful reminder.
It is.
It's not about achieving a certain aesthetic.
Right.
It's about protecting our health.
Exactly.
Now, shifting back to early detection for a moment,
Okay.
you've talked about the ABCDE rule and the importance of checking less obvious areas.
Right.
But what are some of the other subtle signs of melanoma that people might miss?
One source detailed a fascinating case study where the first sign of melanoma was a persistent sore that didn't heal. It wasn't a mole. It was just a small wound that refused to close up.
That's a good reminder that melanoma can masquerade in various forms.
Yes.
It's not always about a distinct mole.
Right.
What other unusual presentations should we be aware of?
Another study highlighted changes in skin texture,
Oh,
a new area of thickening or roughness, especially if it feels different from the surrounding skin, should raise a red flag.
okay.
It could be a sign of something as benign as a wart or as serious as melanoma.
So any change in the feel of your skin, not just the look,
Exactly.
is worth getting checked out. It seems like a melanoma can be quite sneaky.
It can. That's why awareness is so crucial.
Yeah.
Pay attention to your skin, know your body.
Right.
And if something seems off, don't hesitate to seek professional advice.
Yeah, that's good advice.
Early detection is truly our best weapon against this disease.
That's an empowering message. We're not just passive bystanders.
Right.
We have the power to take control of our skin health.
Absolutely.
Now, before we wrap up part 2,
Okay.
you mentioned something about personalized medicine and its potential to revolutionize melanoma treatment.
Yes.
That sounds incredibly promising. What can you
Yeah.
tell us about this exciting field?
Personalized medicine is all about tailoring treatment to the individual patient,
Okay.
moving away from the one-size-fits-all approach.
Right.
And in the world of melanoma, it's opening up incredible new possibilities.
Wow.
But we'll delve into the specifics and the exciting potential it holds in part 3 of our deep dive.
Welcome back to the deep dive. We're wrapping up our exploration of melanoma, and I'm particularly excited to hear more about personalized medicine. You hinted that it's revolutionizing treatment, what makes it so special.
Well, it's all about moving away from that one-size-fits-all approach,
Right.
and recognizing that each person's melanoma is unique, driven by a particular set of genetic mutations.
Okay.
Personalized medicine aims to decode those mutations and target them precisely.
So it's like a customized treatment plan based on your melanoma's DNA blueprint.
Exactly. It's like having a key that unlocks a specific door. One of the articles we reviewed discussed BRAF mutations, which are found in about half of all melanomas. There are now targeted therapies that specifically block the activity of this mutated protein.
Wow.
effectively shutting down a key driver of tumor growth.
So instead of attacking all cells, it zeroes in on the ones fueling the melanoma's growth. That's remarkable. Are there other examples of this targeted approach?
Absolutely. Another source highlighted MEK inhibitors,
Okay.
which target a different protein involved in the same signaling pathway as BRAF. These inhibitors can be used alone or in combination with BRAF inhibitors,
Okay.
creating a powerful 1-2 punch against melanoma cells.
It's like cutting off all the melanoma's escape routes. These targeted therapies sound incredibly promising. Are they effective for all types of melanoma?
That's a crucial point. Not all melanomas have these specific mutations, which is why genetic testing of the tumor is essential.
Right.
It helps determine which patients are most likely to benefit from these targeted therapies.
So it's about matching the right treatment to the right patient based on their tumor's genetic profile. That's truly personalized medicine in action. What about those who don't have these targetable mutations? Are there any promising developments for them?
Research is ongoing, and scientists are constantly identifying new targets and developing new therapies.
Okay.
But even for those without targetable mutations, personalized medicine can still play a role.
Okay.
For example, by analyzing a tumor's genetic makeup,
Right.
doctors can predict how aggressive it might be and tailor the treatment intensity accordingly.
So even if we can't directly target the mutations, understanding them provides valuable information for treatment decisions. It sounds like personalized medicine is not just about new drugs.
Right.
It's about a whole new way of thinking about cancer care.
You've hit the nail on the head. It's about understanding the intricacies of each individual's disease
Yeah.
and using that knowledge to guide treatment decisions. It's about moving away from broad strokes and embracing a more refined,
Right.
personalized approach.
That's incredibly exciting. It seems like the future of melanoma treatment is becoming increasingly precise and personalized. What other breakthroughs are on the horizon? You mentioned melanoma vaccines earlier.
Yeah.
Can you tell us more about those?
Melanoma vaccines are a fascinating area of research.
Okay.
They're still in the experimental stages,
Yeah.
but they hold tremendous potential for both prevention and treatment.
Okay.
Some vaccines aim to prevent melanoma altogether, particularly in high-risk individuals,
Right.
by training the immune system to recognize and destroy melanoma cells before they can take hold.
So it's like giving the immune system a head start in the fight against melanoma.
Precisely. Other vaccines are designed to treat existing melanoma
Okay.
by boosting the immune system's response to the cancer cells,
Right.
essentially turning up the volume on the body's natural defenses.
That's incredible. It's like equipping the immune system with the tools it needs to effectively target and eliminate melanoma. It sounds like we're on the cusp of some truly groundbreaking advances in melanoma care.
We are, and what's particularly encouraging is the collaborative spirit within the melanoma research community.
Okay.
Scientists, clinicians, and patient advocates are working together
Uh-huh.
to accelerate progress and bring these innovative therapies to those who need them most.
That's inspiring to hear. It feels like there's a real sense of hope and determination in this field. Before we wrap up, I want to reflect on everything we've discussed. What are the key takeaways you hope our listener will remember from this deep dive?
First and foremost, melanoma is a serious disease,
Right.
but it's not an unbeatable foe.
Okay.
With early detection, advancements in treatment, and a commitment to prevention,
Yeah.
we can significantly improve outcomes for those affected by melanoma.
Early detection is key. And remember, it's not just about moles. Any unusual skin changes, regardless of color or location,
Right.
warrant attention. Don't hesitate to seek professional advice.
I wholeheartedly agree. And as we've discussed, sun protection is paramount.
Absolutely.
It's not just a summertime concern.
Right.
It's a year-round commitment.
Sunscreen, protective clothing, shade seeking, make them your daily allies.
Exactly.
And for those facing a melanoma diagnosis,
Yeah.
remember that there's hope. Treatment has come a long way, and personalized medicine is opening up incredible new possibilities.
The future of melanoma care is brighter than ever.
Yeah.
And as research continues, we can expect even more breakthroughs that will transform the way we prevent, diagnose, and treat this disease.
This deep dive has been incredibly enlightening. We've journeyed from the basics of melanoma to the cutting-edge research that's paving the way for a brighter future. Thank you for joining us on this exploration.
It's been a pleasure sharing this information with you. And remember, knowledge is power.
Absolutely.
The more we understand about melanoma, the better equipped we are to protect ourselves and our loved ones.